very thank you for Matthew Brady being on the line, who's head of content at Informa Markets, and he's going to be joined by the wonderful Ron Lee of Medical Informatics Director for Digital Health and AI Clinical Integration at Stanford Healthcare. And I'll pass it over to Matthew. Thank you.
Thank you very much, Ben, for that. And thank you very much, Mario, for that really insightful presentation. I'm actually joined as well by Dylon O'Leary, who's just joined. So that's the three of us. And Dylon is director of MyHealthcare, based in the UK. Welcome to you both.
Great to be here.
Can you hear me? Okay, great. Maybe we can start with a question based on Mario's presentation, which was super interesting. But there were lots of fascinating insights into how AI is applied today in different areas, such as medical imaging. So something that was said initially in the presentation, excuse me, because I've actually written a note in my notepad. He highlighted AI as being among the highest areas of adoption in healthcare. And this is something that's been reflected in a survey that we did last year called the Voice of a Healthcare Industry Market Outlook. It was basically a huge annual poll asking healthcare respondents around the world for their sentiments and their particular views on where healthcare is headed. And it turned out that AI is the second actually most impactful area of technology, followed by robotics, blockchain, and big data. But something that's come up a lot in my conversations with healthcare professionals is that, well, I guess it's a misconception expressed by many, which is that AI might replace healthcare professionals. It might take over their work, in essence. And what I hear is that that's not actually the case. It will augment what they do, which is something that Mario himself highlighted. So, I guess the question is, do you find this is a case? Are there any particular fears within the healthcare profession, within the system, over AI? But also, what kind of adjustment is required? Because I imagine that with the induction of AI, with the increasing influence of AI, there'll be a certain degree of adjustment involved in terms of their actual work, their workload, maybe even trying to get their head around new systems. So, maybe we can start with you, Ron. What's your perspective on this?
Thanks, Matt. I think that's a great question, and thank you again for having me here. This is a really important and timely conversation. I guess I'll start off by quoting, and I'm really paraphrasing here, something actually one of my colleagues at Stanford had said that I think is quite astute. And I think I am paraphrasing, but I think what he said was, AI probably won't be replacing physicians, but physicians who use AI might be replacing physicians who don't. And I think that really speaks to what you're saying there, Matt, in terms of what types of adjustments and, how do we think about even medical education? So I think about this quite a bit, actually. So I am a physician, first of all, and I work at an academic medical center, Stanford Healthcare, with the School of Medicine. So I take part in training medical students, medical residents, as well as we have a fellowship called Clinical Informatics, which actually is a post-residency fellowship for physicians, trained physicians who are interested in really taking a deeper dive into informatics, big data, and of course, artificial intelligence. So this is something I really do think a lot, and how do we operationalize that? Well, and maybe before I get into that, to address your other question about how, our health systems, our physicians really thinking about AI in this serious way, I think it's getting there. Certainly it's not, depends on who you are and where you practice and what institution. I can say that our institution definitely is thinking about this very seriously. And we think about AI as not necessarily a solution in and of itself, but it's a capability. It's a capability just like electricity was a capability, back in the day that really transformed how we worked. It's a capability like how, digital data, databases, and the electronic health record became a capability. And it just makes sense. Now we're much more wired. A lot of our data is now digitized. So it's kind of a natural progression that, okay, well, we should then be able to apply analytics to that data, to this large amounts of data that we now have in order to drive care forward. So I think it is real and it's growing. I think where we're not, though, is really, I think, at a full understanding of what that really means. So going back to Mario's point earlier, which I think was really important, was that I think we've made many advancements in the data science, in the development of machine learning models. Of course, there's more to be done. And I actually am quite fascinated by machine learning models trained on medical images. I can talk about more of that later. But I think in terms of the integration, and particularly the clinical integration of this capability into a clinical enterprise, and that means into the workflows and the care models, but even more broadly, I think, just into how a clinical enterprise works. So that's kind of a higher level, thinking about this. It's not just about how do I develop the workflow that might be made possible by AI, but how do you even transform a clinical enterprise, a hospital, a health system, anything that actually can be, that can really understand how to use AI in a durable and resilient way. So that's the other level of integration that I think is really important that we don't have yet. So those are the things that I think about, and happy to speak more, about some of the things we're doing.
So when we talk about transformation, which I guess is the larger scale, change required, do we need a different type of leadership, for instance? I mean, do we have the right leaders in place? Our providers? I mean, do they recognize the benefits of AI and the challenges required, or I guess the challenges that they might face overseeing the organization and transforming the organization? It's not that straightforward, I imagine. What kind of skills are required in order to make all this happen?
Great question. And that's precisely what we think about when we train our fellows in these fellowships, because that is our goal, to be able to prepare our industry for this transformation, right? Because to your point, there probably are skill sets that are needed. Now, I think in terms of leadership, we have great leaders across the health systems in the country, in the world. And there are frankly so many things we have to consider to run a health system. And AI is just one of many things, right? So I think there's a lot of things to think about. But in terms of at least being able to incorporate this capability, I think it's going to be a marriage of existing capabilities and skill sets into other skill sets. So it can't be one or the other. I think some misconception might be that we just need to, hire someone who is an expert in computer science or whatever, and kind of that person can just really lead everything end to end. And I think that's probably not going to be the case, especially if our goal is to incorporate AI as a capability into care delivery, because what that really means is you need people, I think, who, number one, can translate between different skill sets, who can translate between, have the conversation with the data scientists, the machine learning engineers, but then right afterwards get into a meeting with the quality director, for the health system, and then also with the clinical leaders, the chair of cardiology, for example. I think all of these conversations need to be integrated into something that is a solution that actually works for providers and patient care. So yeah, to answer your question, I do think, the leadership, you need leadership, absolutely. I think that's actually really astute of you to say that, and that it's not just about deploying a technology, but you actually really need to transform how an organization works, right? And that comes with leadership to make it happen and make it sustainable. And in terms of the skill sets of these leaders, I think it's an integration of different skill sets. And you might need some people who are really good at certain things that, with skills that don't currently exist. But I think you really do need to, I firmly believe this, elevate the people with existing skill sets who are not necessarily experts in AI, but empower them to be able to be at the table, because they are the ones who are critical and really understand how care is being delivered.
Based on that, are we looking at potentially new jobs created or new, responsibilities, I guess? I mean, what kind of model are we looking at really for this to be successful? What is a model of the future? Are we looking at potentially something that looks more like a startup or a big tech company with product managers and data scientists instead of a traditional, health system provider model?
Well, it's always dangerous to try to predict the future. So I don't know if I can predict the future. What I can say, though, is that I think that the evolution of how health systems, and I can just speak from a health system perspective, of course. I mean, there are many other organizations that use AI in the healthcare space that I'm sure think about this very differently. But from a health system perspective, And, I think we're blessed to be in close proximity to many startups in the technology world at Stanford. So we can learn a lot from them. I mean, I definitely learn a lot from them. I do think this idea of creating products is really interesting. Health systems, of course, we don't really think about products in the same way that a technology company thinks about products. Although if you think about it, I mean, we take care of patients, we provide care, and in many ways, it's that care is the product, right? I mean, that is what people come to our organizations for and expect the highest quality. So I do think that product mindset is interesting because, well, the reason why I think we haven't thought about it as products as much is because care, at least traditionally, has often been very analog. It was not a digital experience. But that is clearly changing. And I think this is a broader conversation beyond just AI. I mean, we talk about digital health and IT and all. I mean, these are all capabilities that they think are changing how care is delivered in a very fundamental way that makes care delivery closer, not equivalent, but closer to some of the products that technology companies create. They're very different, though. I do want to emphasize that. And I actually don't think they'll ever be exactly the same. But it's closer. It's closer than it ever has been. Which means that I do think there is, there is an importance in learning from, technology companies and how they think about product and how can we incorporate some of those learnings and how we then develop and execute on these care models that are made possible by digital capabilities, AI capabilities. I would argue that we don't really know what that product looks like yet. I think we understand how certain care models and workflows look like traditionally. We've been doing that for a long time. I think technology companies understand what a machine learning model looks like and technology products look like. But AI-enabled clinical product that really is integrated into care delivery as a product, I don't really know if we fully understand what that looks like yet. And what I'm excited about in my current role and just being in a health system is that we get to really create that for the first time and not just create it, but test it. So I think the benefit of being in a health system is that we're actually taking care of patients, right? So I think we have an up close and personal view of what care delivery means and what the needs are, but also in that if we create something, either via partnership with industry or even just, through some homegrown solutions, we have this tight feedback with how we deliver care. We can deploy things very quickly. We know exactly what that happens. We're not guessing. And that is powerful, I think. And I think is that actually that commitment to continuous learning, to always being mindful of how your patients, your providers are being affected by this, a commitment to improving what you're doing to improve patient care. I think that's the mindset that really works.
So it all sounds very much like, I guess, like a startup ethos, testing, iterating, pivoting, mm-hmm. and whatnot. You mentioned creating and testing just now earlier. How do you factor patients into all of this? I mean, we talk about patient-centric applications, mm-hmm. fundamentally about the patients at the end of the day. To what extent are they involved in the entire process in terms of like listening to their needs? What is it that they actually look for at the end of the day? Because, mm-hmm. We talk about things from a provider perspective, I guess, but mm-hmm. fundamentally this is about the patients. What is it that they want?
Absolutely. It's all about the patients, right? I mean, I would say the providers are just mediators to the experience of the patients in many ways. And so this is why I do think it's very important, going back to what does integration mean? It means that you're integrating these efforts in, using AI into the organization, which includes parts of the organization that are committed to, optimizing the patient experience. So for example, our health system, we have a whole department on patient experience, and they do a lot of things that are not AI. It's really about just, making sure the patient experience is good, both in a digital and non-digital fashion. So how do we work with that department, for example, every time we do something that is, touching a patient? So that's just a structural thing that I think is important. And this is not uncommon. Many health systems have these capabilities. And to be more concrete, I think what we also have to pay attention to and be aware of is that there are unintended consequences and ripple effects anytime we deploy technology, not just AI. And we've had experiences. We have plenty of experience deploying new technology in healthcare. I mean, apps and communication tools, all sorts of things, right? They're digital. So we have a framework for how do you think about getting patient feedback, provider feedback. And I think we should use that, but also keep in mind that if we introduce machine learning, the effects might be a little different because number one, you're introducing something that's very probabilistic in a world where certainty actually counts for a lot. This is one of the realities of healthcare. I think it's, if you're sick, if you're a patient and you're sick, and you're a provider, you're treating someone with someone who's really sick, this guise of certainty is really comforting. If we have protocols, we have guidelines for that reason, because it gives you a sense of comfort that, hey, I'm doing the right thing. Whereas a patient, hey, this drug I'm taking really is going to work. But that's not really how the world works, unfortunately. The world is probabilistic, even before the advent of AI. And now if we're introducing machine learning, then you're intentionally infusing probabilistic models into how you deliver care, which actually complicates things quite a bit. And really, you have to be really careful about how you communicate that. How do you create experiences that are of course made better by these models, but don't introduce so much complexity and confusion that actually diminishes the patient experience. So these are all just high-level thoughts. I think operationally, what that means is you just have to talk to patients, right? Like, it cannot be nothing you do can be siloed. I think that's also one of the benefits of being in a health system. We take care for patients. We talk to them. It's very easy for us to do that. We have the structures in place, but it's also just a philosophical commitment that whatever you do has effects across the organization and care delivery, and we need to make sure that people are on board with that mindset, and we build the operational structures to empower that.
That's great, thank you. You mentioned a word just now, which is experiences. I've got a question for Dylon. So Dylon, thank you for joining. Can you hear me?
Yeah, I can hear you. Yeah, can you hear me?
Yes, awesome. Yes, I can. We can. Thank you. So let's talk about the patient experience again. So, your line of business, I guess, is virtual reality. And VR is, of course, an exciting new medium to experience new environments, I guess. How does it work in the context of healthcare? How does it benefit the patients having this virtual reality context, I guess?
I think the main benefit would be in terms of pain, and in terms of reducing pain for patients, before a sort of cancer operation, let's say, or in general, any operation, reducing fear, reducing any sort of experience that would be negative, and producing a calm experience for the patient. And I think virtual reality is such an amazing technology for calming people if done properly. I think the main issues with virtual reality is the potential for cyber sickness. Obviously, that can be mitigated by introducing proper virtual reality that isn't too quick, it isn't too sensitive to the motion of a user. So I think virtual reality, and especially in the sense that it can be used to improve patient experience in the form of pain. And I think the other use case could be particularly training for healthcare professionals, filtering down to trainees. And I think this is very important because we need to get as many healthcare professionals as we can at the moment, because I think a lot of healthcare professionals have just been overrun through lack of staff, especially in the UK. And I think virtual reality provides that inspirational drive for healthcare professionals, trainees, to really get to grips with their training, and also inspire the younger generation to get involved with healthcare. And also provides that wow factor to healthcare that I think could really be beneficial to the healthcare sector. And I think we don't just want healthcare to have that wow factor. We want it to be purposeful and be very effective for patients. And I think virtual reality also provides that as well. So, you can have a virtual reality like lab, which could attract people well, I wouldn't say attract people to each other, but it could attract people to healthcare, and that could be interesting. another application of the metaverse could be a patient feedback simulation. So it could be, you could create an AI program that feeds back to the trainee, that could then potentially create an artificially intelligent response based on a response from the trainee. So I think that's a really interesting application, because if you have a situation where you can have an interactive experience with the virtual reality, I think that's really what we're looking at. Could be interesting for training in particular. So that's my take on virtual reality within healthcare, and artificial intelligence used with virtual reality in healthcare.
Thanks for that, Dylon. You mentioned a word earlier, which is the metaverse, and this is actually one of the questions I have planned for today. So there's a lot of talk about the metaverse. The big tech companies are plowing billions into this next dimension or frontier, I guess, of the internet, I suppose. How is this different from VR? What kind of applications are we likely to see within the next few years?
So I think the metaverse, in a sense, is a virtual space by which everyone can access. So I think if we were to have another pandemic, it could be really useful, because it could help people interact across a whole interface that we weren't necessarily able to access before. And I think, especially for people shielding, oddly, it could be a really useful application to be able to access, because it's so useful for reimagining social contact in such a way that it could really help people access data, like access other people in a different way. So the metaverse essentially is a virtual space where people can access each other, but also access events, access their own data potentially. So you could have a situation where you can access your own data in your own virtual space and be able to categorize that with symbols. And I think that's a really interesting application. And you could that's how you integrate big data, blockchain technology, artificial intelligence, and the virtual reality. And I think that's a really interesting application that's going to be the future of healthcare. And I think it's something that I want to work on, and I think a lot of technologists in healthcare want to work on, because it's such an interesting thing to get involved with. It's not necessarily a replacement for healthcare, in a sense, like the system we've got today, but it's an application that could certainly be applied to future pandemics, and also just in general healthcare data, I think.
Thank you for that. So you mentioned big data. So this leads me on to the next question for you, Ron, which is around diversity and inclusion. So, this is critically important. How do we get data right so that it reflects everyone's backgrounds, I guess? How does it work? How can we get it to work for everyone? And how do we get there?
That's a very important question, Matt, and I think I'll be barely scratching the surface with my answer. So I think in terms of how we think about it, I can probably talk about some foundational principles, and I'm sure how we operationalize those principles will really depend on the situation. But I think the principle, number one, to your point, is that it's absolutely critical that we understand the effects of these technologies on different groups, and most importantly, the groups that are vulnerable and underrepresented, because often they're the ones who are not getting the right care. So number one, how do we make sure that we're not, first of all, we're not making it worse for vulnerable groups, because that actually is a risk if we apply AI. But more importantly, I think, how do we make sure that we elevate those groups and actually support them? And in terms of how data plays into this, I think there are a couple of things to think about. So one is just understanding what's in your data sets. For those in the audience who are data scientists or work with data sets, we all know that it's actually really difficult to understand what you have in the data set and what you don't have. I mean, that sounds like an easy question, but it's actually very difficult when you work with data sets. And then, specifically what is represented and what's not represented. I think we need to be very careful and intentional about answering those questions, all the way down to the individual contributor level data scientist who's working with those data sets. I think it's not so much, one person needs to be aware of it. It's like the entire team needs to be aware of how do you think about data that way. And then the other, I think, thing to think about is there is the risk of bias, of course, in the data set itself, and that which could be amplified with machine learning models, which is a risk. I think that's the unique risk with AI that we have to consider. And then there's also what is the bias that could, or the inequity that you could propagate from the intervention itself, the care model, because I do think about those two as different layers. There's the machine learning model, which just basically makes predictions. So that prediction could be biased because of statistics in the data set. But then there's also the actual intervention, the care model, the thing that we actually are applying to care that is affecting patient care. That's enabled by machine learning, whether it's a software device or a workflow. But there's all sorts of other things that go into it that could either mitigate, maybe it actually, you can design it in such a way that mitigates some of the statistical biases that may sometimes even be inevitable, as you train these models, or it could amplify it. And that's a design question. That's not necessarily a data science question. That's a workflow design, systems building question, except that we need to be aware that there is AI in there, and we need to be aware of the biases or lack of biases that the models create. So I would just think about them in two layers. There's the data set and the machine learning models, and how do you optimize for that? And then there's the actual care model, the care delivery mechanism that's made possible by AI, and how do you design those in such a way that, that either protects against bias or hopefully, proactively reaches out to these vulnerable groups so that we have more equity.
Thanks for that. We're actually running out of time. We've only got about 3 minutes left. So let's address a question from the audience, and I'll ask the same question to the two of you. It's quite a fun one, actually. So if you had a magic wand, think Harry Potter, to solve your biggest problem you face, what is that problem? So if you could just, I don't know, if you had $44 billion, say, like Elon Musk, to solve your biggest problem in healthcare, what would that be? And I'll ask Dylon first, and then if you could answer that as well, Ron, immediately after.
I think the biggest problem in healthcare today that we see, for me at least, is the accident and an emergency in the UK is just so inefficient. And I think the waiting times just need to be reduced so much. And if I could invest, it would be in training healthcare staff and getting more people into healthcare in order to reduce the waiting times in healthcare. I'd invest, billions in that, because that is honestly such an issue, because I've actually experienced it myself. So, yeah, that's what I would invest a lot of money in, because I think it's really important that people get the care they need, quickly.
Yeah, no, I totally agree with that. And sorry, yeah, Ron, go ahead, please.
Sure. I'm thinking about this question, and it's very possible that money can't solve this problem, but it's a problem nonetheless. And I think it's the alignment of incentives in a way that delivers best care, motivates the right people, but is still still efficient and cost effective. It's one of those tricky problems, right? But I do think that alignment of incentives, getting the right people at the table, that will then allow the solutions of many other problems we face in healthcare.
Thank you very much for that. And maybe just one final question. So where do you see the future of digital health headed? So if we were to reconvene at this point next year, can you name one change that you'll anticipate seeing within the next 12 months?
You're asking me?
Yeah, the two of you. Yeah, very quickly.
Sure, yeah. I think it's more about digitally enabled solutions and care models rather than the digital first solutions. I think we'll see a lot more of those in healthcare.
Perfect, thank you. And over to you, Dylon.
I think digital health will grow so much, and I think that virtual, as I say, the metaverse will take over, and then we'll see some really interesting developments. So
that sounds amazing.
I'm very hopeful.
Yeah, well, let's hope we sit again next year and see what happens. So on that note, thank you very much for your time. That's a very insightful discussion, quite rushed. I hope we can sit again at some point in the near future and address some of these points in detail. Over to you, Ben.
Thank you, Matt. Thank you, Ron. Thank you, Dylan. I'm sorry to have cut you guys short, but like you said, next year we'll be back. We'll give you a bit longer, and we'll go through it in a bit more detail as well. So to wrap things up, thank you in the audience for attending today's first Healthcare Day session.